afternoon. I'm Dr. Stanley Schack. I'm one of the providers at Ear, Nose, and Throat Consultants. We're here today to talk about sinus disease and ultimately sinus surgery for those patients who we may feel may be a candidate for procedures. And what I'd like to go through with you is one of our typical preoperative visits and what you might expect in one of those visits when you come to see one of our providers. If you look at the diagram behind me here, sinusitis is an inflammation or a disease process affecting, indeed, the paranasal sinuses. These are air-containing spaces outside and adjacent to the nasal cavity, depicted right here in the middle. How do the sinuses work? This is a common question we might get. Essentially, the sinuses make mucus, and they make mucus all day long. That mucus that's produced in the sinus cavities has to go through pathways, essentially pathways that then lead down to the back of the nose and throat. And in fact, we all drain about 1 quart of mucus a day into the back of our nose and throat. For those of us who don't have sinus blockage or sinus disease, we're not conscious of that because the viscosity or the thickness of the mucus is such that it's very thin and we do not feel it. However, in patients who do have sinus disease and sinus blockage, that mucus gets very thick. Well, how does it get thick? It goes around and around in a circle and gets thicker and thicker and thicker. In many instances, as thick as almost like a pudding consistency. So patients then notice significantly drainage in the back of the nose and throat. And I would tell you that the #1 symptom with sinusitis by far would be drainage in the back of the nose and throat. That comes as a surprise to some patients who think that, well, I don't have headache, so I must not have a sinus problem. Indeed, drainage in the back of the nose and throat, by far, the #1 symptom. I liken this to our sink over here. Essentially, the sinuses make mucus, just like the water produced in our sink, and that water is going down a drain right now. And as long as that drain is open, life is good. As long as the drains from our sinuses are open, the mucus drains out, life is good. But once there is a plug or a blockage in the drain underneath the sink, then what happens? The water overflows the sink and we have a problem. And how do we fix that problem? In many instances, we need a plumber for the sink, and I'm your plumber for your sinuses. So a typical patient who will come in for sinus problems and ultimately may require sinus surgery is someone who has essentially failed a round of medication. That is usually 1 to 2 months of antibiotic therapy, steroid nasal spray, neti pots are very common now, ocean spray, antihistamines, and a variety of other therapies. But ultimately, if your primary care physician or if we are struggling to get improvement for you with your sinus problem, we might need to consider a surgical maneuver. So patients will come to us and we will consider them for a scan, a CAT scan of their sinus. And we do that when a patient has essentially failed medical therapy and we're almost thinking we might need to proceed with an operation of some sort. Our CAT scanner that we have in our office is very user-friendly. It takes only a couple of minutes to get a scan done. It has 10% of the radiation dose that hospital scanners have, and we feel it is a very economical cost for our patient. Then the patient will come with their scan to this room right here, sit in this office. We then will perform an endoscopy. This is one of many scopes that we have in our office. This is a rigid scope that we use to examine the nasal and sinus passageways. We have a variety of other scopes, some longer, some smaller, different angulations. Some are rigid like this, some are even flexible to look in the throat. But regardless of the type of scope we're using, the provider will choose the best instrument to give him the best idea of the anatomy to help us determine which one of perhaps 30 to 40 different operations we might offer a patient that would be most effective and applicable for that particular patient. If I find a patient that truly I feel will benefit from sinus surgery and I have nothing else to offer them, I will explain that to them. I'll go over the risks and the benefits. Risks are very rare. I feel very ethically compelled to mention those rare risks, which I essentially describe as perhaps 1 in 10 to 20,000 patients who may get a significant problem or complication. But I feel very ethically compelled to be quite transparent and honest with every patient so they can make a good decision for themselves. When we then think about benefit with sinus surgery, about 90% is our success rate. What does that mean? That means we're trying to make things better. We're not God. If we can make you better, then we're happy. We love to hit home runs all the time, but it's more common to hit a single or a double. And we'll take that. We'll take that. But the patient makes the decision with us and essentially makes it for us because we give the patient all their options. But I always, in this more or less preoperative consultation, discuss some non-surgical alternatives. Essentially, a patient who comes in to see us may choose, if they want, to essentially do nothing. They can live with their symptoms, and if their symptoms are livable and they'd rather do essentially nothing, then that is certainly their choice. That is probably the very most conservative option. Option 2, well, we can use medications. We can use sprays, we can use antihistamines, we can use rinses, and we can do those things indefinitely if those things will work and if that is helpful enough for a particular patient. We just can't do antibiotics forever. That's our limitation. We do have a third option. Now in our office we offer allergy testing, our own allergy testing, that we're quite excited about and have had tremendous result, a fair amount of praise for the satisfaction that our patients have. And we offer allergy testing and allergy program, and indeed some patients might be a candidate for that, especially in a patient who may just not want to have surgery, or maybe their health is such they're just not a really good surgical candidate. However, option 4 is the surgical option, and I tell patients that surgical options are for structural problems. You have a crooked septum or a broken nose. I have no spray, pill, or rinse that is going to, for example, straighten cartilage. That requires a surgical fix. Then our hope is when a patient has normal anatomy, or normal enough, as well as we can get it normalized, then that patient may have better chances in having simpler medical therapies work, like antihistamines or sprays, or maybe there's a patient who does have some seasonal allergies or year-round allergies that might be amenable to immunotherapy with allergy shots, our allergy drop program, and other therapies. But much like building a room right here, the structure has to be built. We have to build this room before we can do something functional about the physiology, such as for the room, turn on the electricity, turn on the water. You have to have the room first. So in our patients who do have structural problems, we're quite candid that we really are committed to helping you fix your anatomy, if that is your choice and you agree with us, and then we can pursue some of the other physiologic options down the road. So I hope I've answered your questions today. Certainly this is a rather brief presentation and every patient's symptoms are different, but we do hope you will come and visit with one of our providers if you or your primary care physician feels that it may be in your best interest to seek out an ear, nose, and throat consultation for your sinus or nasal problems. Thank you.